A doctor sat me down and said, yeah, your biopsy results show you've got prostate cancer, and that was 3 weeks before I turned 50.
It was a very stressful time to talk about even the possibility that something would happen.
We think about prostate cancer as being a disease of the patient, but really most cancer diagnoses are diseases of the family, where one person is the one with the manifestations of the disease, and then the family has to deal with the fallout from the things that the disease does.
We had talked about death and older family members. The kids would attend the funeral and understood the issues, but until then both my wife and I had been in very good physical health.
Patients make a number of assumptions about what their families and caregivers either know about them or know about what they would want. At the hospital, we certainly have seen that not only for cancer diagnoses, but for other significant diagnoses, that we're seeing people who unfortunately do not have these plans in place and their families are struggling.
I think personally I didn't really want to have too much of a conversation about that. It was a little bit too, sort of thinking that, well, yeah, we're talking about this as if something might go wrong.
They're uncomfortable. You're talking about life or death sometimes, right? And those are not conversations that we're comfortable having.
We'd already had a lot of these conversations when we had our wills done, specifically to do with his cancer diagnosis. Was, okay, are we still on the same page?
Ask the person who would most likely be making decisions in their best interest what they think they would like if they couldn't make a decision for themselves.
I knew that I was speaking directly for what he wanted to have done. And I think as far as the kids were concerned, they were all completely on board with what we had talked about.
But you see families band together and sometimes get stronger because of it and go forward with a kind of a united front.
It doesn't mean it's maybe easier to accept at that time for that person that's got to enforce that or put that into force, but at least it's there.
It's not so much that just because they have prostate cancer they should be doing advanced care planning. They should do it anyway.
If you love this person, if this person's important to you, then you owe it to her to have this conversation, as she owes it to you to have the conversation.